This meeting is being recorded.
Myself, sir, Dr. Anand Patel.
So you can share your screen. Number one is Anand Patil. Okay. Where are you from, Anand?
I am from Belgaum, sir, Karnataka.
Yeah, I forgot. Many months I have not met you
Yes,
guys.
yes. So,
ಚೆನ್ನಾಗಿದ್ದೀರಾ?
ಚೆನ್ನಾಗಿದೆ ಸರ್. ನೀವು ಚೆನ್ನಾಗಿದ್ದೀರಿ ಸರ್? Happy Deepavali, sir.
ಎಲ್ಲರಿಗೂ, all of you. Happy Deepavali to all of you.
Thank you, sir.
Thank you, sir. Happy Diwali.
Yeah, who is number 2? Who is the second presenter?
Sir, Arun, sir.
Arun, okay. And the third? Number 3?
Number 3, Arila.
Somebody has to be there. Number 4?
Sir, madam had made a list of the sequence of presentation, sir. I just read out. So we are all in one page, sir.
Yeah.
It is number 1 is Anand Patil, 2 is Dr. Meenakshi, 3 is Dr. Sandhya, 4 is Dr. Rohit.
Wait. I'm writing down. 4 is, 3 is?
Sir, 3 is Dr. Sandhya.
Okay. 4.
4 is Dr. Rohit.
Okay. 5.
5 is Dr. Arun.
Okay. 6.
Dr. Siddharth.
Mm-hmm. Go
7,
ahead.
Dr. Shilpa.
Oh, we only 7.
Yes.
Let me call madam.
Yeah, I think so. Yeah, madam has joined, so I think we can start. Madam, your audio.
I said Happy Diwali and Happy New Year to everyone.
Yeah.
Thank you, madam. Happy Deepavali, madam.
Yeah. So Rohit, you start.
No, Anand Patil.
Sir, okay. After Anand Patil, Rohit, you have to start.
Okay, ma'am.
After
Okay.
Rohit, Siddharth.
Oh, 1 minute. I was given a list of
Sir, these
Anand,
people have not
Meenakshi.
presented. Every time the girls are ready and they are presenting and Arun Kumar and they remain. So let me give good hearing to them.
Okay.
And then whatever order you take is okay. Okay, Anand, start.
Yes.
Yeah.
Madam. Yes. Good afternoon, everyone. Now I request Dr. Arun sir to kindly share the PPT on my behalf. Yes. So the project title of mine is the awareness and perceptions of elective courses in BDS curriculum, a cross-sectional survey among the teaching faculty in Karnataka.
Can you put it in full screen?
Sir, it's placed on full screen, sir.
Okay. Not able to.
Okay.
Hello, you unshare first and then again start sharing and share a full screen because we are able to see only your PPT mode, not a full screen mode.
All right, sir. I will.
So
इधर बैठती नहीं है क्योंकि तुम लोग को इधर अच्छा लगेगा करके है।
Can you all see the full screen?
No, we can't. We can't.
you don't share PPT, you select a share screen. So then you will not have any problem.
All right.
It's okay. Carry on.
Okay, sir. So
Now
my
it's okay.
Yes. My project title is Awareness and Perceptions of Elective Courses in BDS Curriculum, a cross-sectional survey among the teaching faculty in Karnataka. So I did this project under the able guidance of Dr. Suhasini Nagdam Madam and Dr. Chinmay Shah sir and Dr. Gaurav Butcher sir. So the project problem statement is the current BDS curriculum has remained largely unchanged and focusing on core subjects. However, the evolving dental landscape demands more clinical and specialized skills. So there is a lack of sufficient practical exposure to the students, and the current curriculum lacks the elective options, hindering the students' ability to explore. So with this, the background, the purpose of the project taken, why you've taken up is the dental education plays a crucial role in producing the competent dental professionals who can cater to the diverse needs of the patients. However, in India, the dental curriculum has been criticized for its traditional structure and lack of flexibility, leading to skill gap between the graduates and industry expectation. So this gap can be attributed to various factors such as outdated curriculum, inadequate exposure to the clinical practice, and lack of emphasis on research and critical thinking skills, and the lack of horizontal and vertical integration of the syllabus and clinical exposure. So by adding this elective courses to the current BDS curriculum, so we can able to achieve the professional development, the employability enhancement, the leadership and management, the skill enhancement, the healthcare needs, and student-centric learning, because the traditional one is the teacher-centric, and so wanted to shift from teacher-centric to the student-centric learning. So the methodology for this, what we've chosen is this strategy involves the collaboration with the industry experts like teaching faculty, the governing bodies who design the curriculum like DCI, which does the planning and integration, and student feedback. So all these are involved in this project. So the initially would took the feedback only from the teaching faculty, and later on it will be extended to the other collaborative partners. So in this, initially we started with a cross-sectional survey, which is conducted through the Google Forms to evaluate the awareness, perception, and need for the electives among the teaching faculty in Karnataka State, India, to assess and recommend the suggest the DCI to bring the reforms to the existing BDS curriculum. So this is the Google form which we have created, which is involving around 28 questions. So out of which the 5 questions are related to the demographic details, related to the sex of the study population, and the gender, we can say, the teaching faculty, their experience, and then the college which they are affiliated, whether they are attached to a government, private, or a deemed university, and the place whether, because later on want to extend it to pan India, so want to divide it Karnataka and non-Karnataka. And related to the awareness questions, we have framed almost 10 awareness questions and 10 perception questions. And each of these questions, we are given a 5 options. And the Richard's 5 scale, we are given, say, for example, here I just want to read out one question. Say, in the awareness question, are you aware of the content of the existing previous curriculum of the Dental Council of India? So we have given a choice like very much unaware, unaware, neutral, aware, and very much aware. So under this Richard 5-point scale, we are given these options. Similarly, for the perception question also, I want to read one example here. Do you feel there is a lack of interest in students for the course content of the existing British curriculum? So the options which were given are strongly disagree, disagree, not sure, agree, and strongly disagree. And under the discussion, after obtaining these awareness and perception questions, so came to this discussion point where the more than 85% of the faculty population are aware of the existing British curriculum, and they felt that there is a need to bring the change in the existing curriculum. The more than 75% of the faculty population are aware that new syllabus with electives gives the advanced learning opportunity to the students, and they felt that there is a need to add clinical implantology and laser dentistry as elective subjects. More than 80% of the faculty population are aware that electives are selected based on the individual choice of interest and have perception that it gives the freedom and autonomy of learning to the students. And nearly 75% of the study population are aware that inclusion of electives will help in invoking interest among the students and have perception that it helps them in overall development. And nearly 87% of the faculty population are aware that these electives helps in student-centric learning, and 50% have perception that these electives thereby does not affect the stress among the students, and only 37% have perception that might increase the stress among the students. Nearly 34% of the study population have perception that the new syllabus with electives improves the employability of the students. However, 50% of the population are not sure. So with these results, I would like to conclude that according to the survey which you conducted, the more than 85% of the teaching faculty are aware of the existing British curriculum, and they all felt there is a need to bring the change in the existing curriculum by integrating with the electives and more clinical exposure students. More than 70 teaching faculty have perception that new syllabus with electives gives the advanced learning opportunities to the students, and they felt there is a need to add clinical implantology and laser dentistry as elective subjects. The new syllabus with electives will help in overall development of skill in students and might enhance the employability of the students. So what are the implications of taking up this study? So it can affect in 3 ways. That is, it will have an educational implication, professional implications, and institutional implications. So under the educational implication, the curriculum reform by integrating electives to enhance the practical skills, and the research-oriented education will help by fostering the critical thinking and scientific approach. And under the professional implications, it helps in employability, industry needs, and leadership and management skills in the students. And as an institutional, it will have these following implications, like the institutional can have its own elective courses, and thereby the curriculum differentiation can happen, and the institute can stand apart from the other contemporary institutes. And it helps in the faculty development of the institutes and accreditation and ranking like NAC and UGC ranking, and it helps in resource allocation of the existing staff can be utilized for the development of this course. And with this, I would like to conclude my presentation. Thank you, sir. And I have done
Yeah.
a e-book also for this purpose, madam. and it is just similar to that whatever I've done in the PPT, the same thing I've added it in the poster.
Poster has to be little graphical. There's so much reading people will not do. So you
Yes.
change and send it to me in couple of days.
Yes, madam. Yes, madam.
It has to have a graph. It has to have representations. It can have your meeting round table, whatever, it has to
Yes,
be interesting and also add a few colors. I'm not saying don't ever have a black background for a.
okay.
Chari sir, any input?
No, I think it's a good project. Awareness and perceptions of electives is very important at this point of time. My only question to Anand is you have given in your title, you say Karnataka. So have you
Yes.
covered the entire state of Karnataka by the questionnaire or only few colleges?
Actually, I have circulated to all our Karnataka faculty groups, sir, but received only a few responses from them. So I'm awaiting for the further responses from all the
Karnataka may have 40 colleges. If you have not covered everything and covered only in and around Belgaum, you can put it as whatever that North Karnataka or I don't know what. I don't know.
Karnataka becomes too far-reaching because I don't think you'll be able to cover Karnataka. Title should be appropriate to what your aims and objectives are. So the
Yes.
title Karnataka is the only thing which I have a doubt. Second is implications of the study is, I think, little more far-reaching. Just by adding electives, I don't think we can reach to such implications of professional level, from leadership level and NAC level and all that. So you have to be slightly more
Sir, that is a
careful when
long
you.
term. That's a long term he expects.
long term. Yes.
Yeah.
I know, but then you should mention it is long term. Don't make it
Yes.
as an
Yes.
It's
implication of the
always
project.
short term, immediate,
No.
that is.
I know,
and
but
middle and long term.
yeah, but he mentioned
Intermediate
it
and
as,
long term.
yeah, please mention that clearly.
Of course.
Thank you very
Okay.
much. Thank you, Anand.
Thanks.
And
Thank you,
change the implications to the short term and long term and intermediate. Okay.
Okay.
And the title you come back, think about it. But please send the poster. This poster in IPS, nobody will see.
Okay,
Nobody
madam. I
will
will
see.
add a graphic to that, madam.
It has to be.
Initially, I thought I will add to
You
that, but
sent me, I
later.
already wrote to them many times that change it. In fact, I after later on I left it to Sandhya, saying that now you do it yourself because
This
yeah.
laser was not one of the electives added in your curriculum. Laser or
No,
one more
no,
thing.
There is no
Currently,
elective,
it is
sir.
not there, sir. Currently, it is not there.
Elective is not there.
So it's a new finding. That means you are trying to
Yes, sir.
suggest that these two should be also included in the electives.
Yes,
That's
sir.
a very good finding.
Yes, sir. Yes.
Okay.
Thank you, sir.
Next, Rohit.
Yes, ma'am.
After Rohit, it is Siddharth. Who is Shivan? Who is Shivan Saraswati joined here? Sir, is it you?
No, not me.
Who is Shivan?
I'm here. Shivan is here.
Who is it?
I got the invitation. I joined it. I'm a former medical school faculty, a FIMR fellow.
Acha. You got invitation from Chinmay?
From Cchpe. I got a WhatsApp message.
Okay.
Okay. So, ma'am, this may be because of our link. Those who have once registered,
Okay. As long
no
as
problem.
medical faculty, there is no problem. Yeah.
Yeah, ma'am, shall I start?
Welcome, Dr. Shivan.
Thank you.
Yes, ma'am, shall I start, ma'am?
Yeah.
Yeah, very good afternoon, everybody. Myself, Dr. Rohit Kumar Singh, I completed a project on evaluating the effectiveness of early clinical exposure on knowledge and prosthodontic skill patient among second-year dental student or randomized control trial. This study I completed under the guidance of Suhasini ma'am, Gaurang sir, and Chinmay sir.
I can't see your slide.
Sir, now?
No.
No, your slide is not visible.
Okay, sir. Again, I will say. Now, sir?
Yes.
Yeah, it's okay now.
Okay. So my study title is Evaluating the Effectiveness of Early Clinical Exposure on Knowledge and Prosthodontic Skill Equation among Second Year Dental Student. And I completed this study under the guidance of Suhasini ma'am, Gaurang sir, and Chenmai sir. So the project statement problem is in traditional preclinical dental education, a second year students primarily receive instruction through didactic lecture and demonstration, which limited exposure to real clinical environment. This teaching approach often leads to gaps in the retention of theoretical knowledge and inadequate skill development, causing anxiety during the transition to the clinical practice. The lack of early patient interaction diminishes the student understanding of practical application of their learning, particularly in prosthodontics, where the practical skill such as denture fabrication is very critical. To address this issue, early clinical exposure has been suggested as a strategy to enhance the both knowledge retention and skill acquisition by providing students with a real-world clinical experience earlier in their education. While ECE effective in the medical education has been well documented, and there is a limited evidence on its impact in dental education, particularly in the Indian context. This study aims to evaluate the effectiveness of incorporating an ECE module in preclinical prosthodontics for second-year dental students and assess its impact on their knowledge, acquisition, and practical skill development compared to traditional teaching method. So the purpose of my study is to evaluate the effectiveness of early clinical exposure module in improving knowledge and prosthodontic skill acquisition among second-year dental students compared to traditional didactic teaching methods. Aim of the study is to test the effectiveness of early clinical exposure module in preclinical prosthodontics on the performance of second-year dental students. Objective is to compare the knowledge and skill of students trained using conventional didactic lecture with those who trained with a combination of lecture and early clinical exposure module to assess the perception of dental students regarding early clinical exposure. Methodology is to, in this study, will be a randomized control trial planned to conduct among second-year dental students in ESIC Dental College after obtaining ethical clearance from the institution. The purpose of this study will be explained to the participants. The participant will be informed that their decision to participate in the study will be voluntary and their non-participation will not affect their academics. A written informed consent will obtain from them. 2 focus group discussions were conducted with 2 different groups of third-year students and 1 focus group discussion held with prosthodontic faculty to determine the difficulties encountered by students during the process of learning and teaching the subject of preclinical prosthodontics. The focus group discussion revealed that impression making using alginate was one of the topics found to be difficult to learn by the student, and based on that, an ECE module was designed which consists of multiple choice questions, objective structural practical examination station, PowerPoint lecture, and the video recording. Then I prepared a module, a lesson plan and alginate impression was prepared, reviewed, and updated based on feedback with the other staff. A 30-minute video demonstration that reveals that complete clinical procedure on a patient was created, including English narration covering step-by-step technique, ornamentarium, patient and operator position, anatomical landmark, tray selection, alginate mixing, impression making, and the reading. Faculty member reviewed that, edited the video for final use in the study. Assessment tools, including 20 MCQ and 5 OSPE stations, were designed to evaluate student learning with MCQ crafted around the learning objective and item analysis conducted on second-year student for quality assurance. Then study procedure and assessment method. 40 second-year dental student will be randomly divided through the flip-up coin method into a control group and a study group. Both groups will receive 2 hours of didactic lecture and 20 hours of practical session led by a single investigator using a tutor guide to ensure consistent information. That control group will receive traditional lecture only, while the study group will also view a video demonstration on the procedure. A pre-test will assess baseline knowledge, followed by post-intervention MCQ and OSPE for knowledge and skill evaluation. To ensure equal learning benefit, the control group will also view the video after completing the study. So these are my MCQ question what I designed to check their knowledge. And these are the OSPE station where I check their skill, how much they understand. Results data was entered into Microsoft Excel spreadsheet and was checked for any discrepancies. Summarized data was presented using table and the graph. The data was analyzed by SPSS. Shapiro walk test will use to check which all variables were followed by normal distribution. Then data was normally distributed, therefore an interfacial statistical was performed using the parametric test. For intergroup comparison of independent data, independent t-test was used. Level of statistical significance was set at p-value was less than 0.05. So first I compared that OSPE station, the comparison of OSPE score between the control group and study group indicate a substantial difference in the performance. The study group scored significantly higher with the mean of OSPE score was 42.25 compared to control group, which mean score was 27.25. This difference is mean supported by a p-value of 0.001, suggested that observed variation between group is statistically significant. Whereas in MCQ, in multiple choice question assessment, the study group was again outperformed in compared to control group with a mean score of 19.30, where the control group was 16.10 in the control group. The p-value is again 0.001, demonstrate that this difference in MCQ performance is statistically significant between two groups. So the discussion, the finding from this study will contribute to the understanding the effectiveness of early clinical exposure in dental education, particularly in preclinical prosthodontics. The result will likely indicate that whether incorporating ECE enhance student knowledge, skill equation compared to traditional didactic lecture. Previous research in medical education, such as studies by Cchpe et al., demonstrate improved knowledge, skill, and attitude with the use of ECE in the medical student. Additionally, studies like those conducted by Cchpe et al. Showed improved learning outcome and student satisfaction when clinical exposure was introduced early. Similarly, the integration of ECE into dental education shown by the overas resulted in significant improvement in second-year dental student performance in clinical and theoretical assessment. The ECE model developed based on the difficulties identified through the focus group discussion is expected to offer a hands-on learning experience, bridging the gap between preclinical education and the clinical practice. By providing an opportunity for a student to observe clinical procedure early on, ECE might reduce the anxiety associated with transition to clinical setting and enhance student confidence and motivation. The assessment of a student through MCQ and OSPE station will offer objective evidence of knowledge, equation, and skill performance. Should the ECE group outperform and control group, this would support the inclusion of clinical exposure in the preclinical year of the dental education, aligning with similar reform in medical curricula, such as those proposed by the Medical Council of India. Moreover, the student feedback on ECE module will provide valuable insight into its impact on their learning experience and the professional development. Ultimately, the study could advocate for wider implementation of ECE in the dental education, emphasizing its role in making theoretical concept more relatable to clinical practice and potentially improving an overall educational outcome. These are my conclusions. The study aims to evaluate the effectiveness of early clinical exposure in enhancing the knowledge and the prosthodontic skill of second-year student compared to conventional didactic lecture. Based on this methodology and expected outcome, the study's finding will likely reveal that incorporating ECE alongside traditional teaching method results in superior knowledge, equation, and skill development in dental education. The early exposure to clinical environment may reduce the dental anxiety or student anxiety, increasing motivation and enhance their confidence in handling clinical procedure. The significant improvement in the performance as assessed through multiple choice question and auscultation is expected to support the inclusion of EC in dental education. Clinical implication, the result of this study could have significant implication for the design of dental education curricula. If ECE is found to be effective, it would underscore the need for integrating clinical exposure early in the preclinical year of dental training, providing a more hands-on, realistic approach to the learning. This would not only enhance the student clinical competence, but also help bridge the gap between theoretical knowledge and its application in real-world setting. Furthermore, the study could encourage the dental school, particularly in India, to revise their curricula to include EC, aligning with similar initiatives in medical education. This approach could lead to improved clinical outcome, better student preparedness for patient care, and more effective transition into clinical practice. Additionally, it may contribute to the professional development of dental students, fostering a deeper understanding of their role as a healthcare provider. Thank you, sir. I'll share my.
Yeah, thank you, Rohit. That was a good presentation.
Okay, sir. Sir, this is the poster what I prepared.
Yeah. Go ahead. We can't
So
see
this
that.
is okay. Sir, now you are able to see.
No, not able to see. Anyway, you can show the poster later on too, madam.
Okay.
I have only few things to. Early clinical exposure was done through video. That's what you mean.
Sir, video. Then after that, I made a practical station where student practiced also. The teaching method was done through the videos. Then I given the demos for the study group, and then I compared.
They did not actually go to the clinical setup and see and come back. The exposure was not physical. It was through video.
Yes, sir. Yes, sir.
Okay. Okay. And you throughout you are mentioning will be done, will be done. Have you not completed this project?
Completed, sir.
Please change that.
Yeah.
Please change that text into
yes,
it is completed.
Okay, sir.
All through your presentations you are mentioning will be conducted, will help, will do.
No, sir. Completed, sir. I'll change that. Yes.
Yeah, please do that.
And what about the practice session? Practice session can be given to conventional learners and the early clinical exposure, right?
Ma'am, early clinical exposure, conventional learner, once the study will be completed, then I will add.
No, now only you said no. One is video method. One is demonstration you give them.
Yes, demonstration.
Demonstration is given to the other people also.
No, ma'am. Other people only how we are teaching them.
We give demonstration and teach.
But not in that broad way, ma'am.
Not in the?
Means we are not focusing much demonstration, just we are giving only once. For this, I kept it 20 hours to repeated demonstration and the video demonstration.
That is not feasible, Rohit. Because see, generally in very good colleges, not very good, but good colleges, they are given demonstration in the group of 10, 15, 15, 20. And they are again if they, after they do certain work, they are come and show also.
Yes.
So this will create a bias because the significance what you have shown here in your college, you don't give demonstration. They do it on their own.
No, ma'am. We are giving demonstration.
You took up a technique, right?
Yes.
Alginate mixing.
Yeah, alginate mixing and the impression making.
तो एक बार तो बताएगा ना सबको demonstration.
Yes, ma'am.
And then?
But ma'am, in demonstration, they are not getting that clinical exposure also when they are going to make impression. So what
they don't make in the second year at all impressions of the cast also.
Ma'am, they are making in the cast, but in cast that oral cavity environment won't be there.
So they do it of each other, you mean?
Yeah, they are do it on the model only.
Yeah.
So Here,
Anyway, you have done it, but it's not that right method of early clinical exposure is actually, as Chari sir said, it's not only video, it is not only demonstration, it is paper, actual exposure to the clinic and community exposure.
okay, ma'am.
Show the poster at least.
Okay. Ma'am, able to see?
Yeah. See, it's full of writing. You have to make it a proper way.
Okay, ma'am.
And all the questions can be given as a link also. Only the question highlight can be given the question.
Okay, okay.
But whatever your answers were in the Likert scale or whatever you want to write, that can be given as a link.
Okay.
You mean to say you will stand before a poster like this and read?
No, no, ma'am. Nobody is going to read.
Then you have to do it like that.
Okay, ma'am.
See, and when you have early clinical exposure, now it should be such that it is robust. You cannot take this project ahead.
Okay.
Tari sir and all don't may understand the dental part of it. You understand? As a project, it is good. I'm not saying no.
Okay, ma'am.
But that slight on the methodology part, we have been continuously telling you, I have been telling you about randomized control trial also. Then you said, no, you use the table. You use the table ultimately?
Actually, ma'am, that when I divided that students, so I thought to like
Even
flip a
number
coin.
and don't put it as randomized control trial. Just put it as a study.
Okay, ma'am.
It's just an observational study.
Okay, fine.
Don't put the study name. Don't put randomized control trial.
Okay.
Huh? Okay. Next one, Siddharth.
Yeah, madam.
After Siddharth, it will be Shilpa. Then Sandhya.
Yes, ma'am.
And then Meenakshi and last Arun. Arun's project I know by heart.
Good afternoon, sir. Good afternoon, madam. I will be presenting my project, which I have done on implementation of a preclinical module of oral implantology for final year BDS students. It was guided by Dr. Chinmay sir and Dr. Suhasini Nagda, madam. Now, the project problem statement was inadequate hands-on skills and exposure to oral implantology in the current undergraduate dental curriculum. Increased demand for dental implants as a preferred tooth replacement option, the necessity to align Indian dental education with international standards. The background, what we had found out for this particular study was dental live implants have been given advantage to the profession and have given the patient an effective and privileged means of tooth replacement. Oral implantology has taken a mainstream mode of replacement for edentulousness. Hence it is the moral obligation of healthcare providers to educate and motivate the general population about the superior modes of treatments in the field of dentistry. Implementation amongst the undergraduate medical and dental students concerning any new updates in the specialty will be beneficial in educating the general population, as undergraduate students are considered the brand ambassadors of the specialty. Context. Oral implantology has emerged as a significant branch in dentistry worldwide and has been given separate status in universities abroad. In India, the practice of treating patients with implants is on rise. Thus, the inclusion of this branch into the undergraduate curriculum has become essential and demanding emphasis on upgrading the practical knowledge of the students. The objective is to impart basic knowledge of oral implantology to undergraduates, enabling them to diagnose, plan treatments, carry out the necessary pre-surgical mouth preparations, and treat or refer patients to the specialty centers. This teaching program is conducted by the departments of oral surgery, prosthodontics, and periodontics. Methodology was based on Kern's model, which comes under 6 factors. First one is the problem identification, lack of practical skills on oral implantology among undergraduate students. A need assessment was done wherein a retrospective survey and focus group discussion with the students, educators, and the practicing dentists to identify gaps in the current training was Done. Goal: establishment of oral implantology as a standard part of the undergraduate curriculum. Educational strategies: curriculum development. Collaborate with the departments like oral surgery, prosthodontics, and periodontics to develop the module content, including lectures, practical workshops, and clinical rotations. Pilot implementation: implement the module on a trial basis with a small group of final year students was done. Evaluation: use of pre and post tests, practical exams, self-assessment surveys, supervisor feedback, and patient feedback to evaluate the effectiveness of the module was done. Revision and scaling was based on the evaluation results, revised the module content and the teaching methods, and gradually scaled up implementation to include all final year students was done. Continuous improvement was observed by establishing a feedback loop for ongoing assessment and improvement of the module. Findings: improved knowledge of oral implantology. Pre and post module assessment showed significant improvement students' understanding of basic oral implantology concepts. The average test scores increased by 30%, indicating enhanced theoretical knowledge. Increased confidence in treatment planning. Self-assessment surveys revealed that 85% of students felt more confident in diagnosing and planning treatment for oral implants after completing the module. This was supported by a 25% improvement in case study discussions. Enhanced practical skills. Practical examinations results showed that 90% of the students demonstrated competence in performing pre-surgical mouth preparations. This suggests the workshop and supervised clinical practice were effective. Application in clinical practice. Clinical supervisor feedback indicated that 70% of the students successfully integrated their knowledge into clinical practice, making accurate diagnosis and referrals. Student referrals. The number of cases diagnosed and referred to the specialty centers by increased students increased by 40%, showing the practical applicability of the module. These were my results from the statistical analysis, like pre and post module assessment scores, self-assessment survey results, practical skills competency scores, student-driven referrals to the specialty centers. The short-term outcomes of the module was improved knowledge of basic oral implantology concept, increased confidence in diagnosing and treatment planning for oral implants, enhanced practical skills in pre-surgical mouth preparations. Intermediate outcomes: integration of oral implantology knowledge into clinical practice, increased number of cases diagnosed and referred to specialty centers, development of a comprehensive understanding of oral implantology's role in comprehensive dental care. My long-term outcomes: establishment of oral implantology as a standard part of the undergraduate curriculum, improved patient outcomes due to better trained dentists in implantology, contribution to the advancement of dental education standards in India. Coming on to the discussion, the implementation of the preclinical oral implantology module for final BDS students demonstrated significant improvements in both theoretical and practical knowledge. The data suggests that the students gained the necessary confidence and skills to apply their knowledge in real-world settings. This is crucial in a rapid evolving field like oral implantology, where practical exposure during undergraduate training can significantly impact future clinical practice. However, certain challenges were noted, including variability in the students' baseline knowledge, limited availability of clinical cases during the module. These factors may have influenced the extent to which students could apply their skills. Additionally, resistance from some faculty members regarding the integration of a new content into an already packed curriculum was observed. Conclusion: the integration of a structured preclinical oral implantology module is an effective strategy to bridge the gap between the theoretical knowledge and practical application in dental education. The positive outcome suggests that incorporating such modules into the undergraduate curriculum can better prepare students for advanced clinical practices, ultimately improving patient outcomes. Implication for dental education: the success of this module will serve as a model for other dental schools in India, encouraging the inclusion of oral implantology in their curricula. This aligns with the goal of bringing Indian dental education up to international standards. For curriculum development, the findings suggest that similar modules could be developed for other specialized areas in dentistry, ensuring a comprehensive education that addresses both demands and future trends in dental care. For future research, further studies could focus on long-term outcomes, such as tracking the professional progress of students who completed the module, assessing patient outcomes treated by these students. For policymakers, the data supports advocating for policy changes at the educational institution and government levels to formalize the inclusion of advanced dental practices like implantology in undergraduate curricula. Thank you, sir. I'll just share my poster as well. Is it visible, madam?
Yeah, looks good.
Thank you, sir.
Yeah, it's a good project, Siddharth,
Thank you, sir.
and you've done a good job. My only concern was that you started off with a small group of final year students,
Yes, sir.
and then you took the entire final year students. That's what you mean?
Sir, for the hands-on module, we took a small group of students. For the lectures and observation in the clinical procedures, we included all the final year students. Sir.
No. The impact of the project or the implications of the projects are related to the small group findings or the entire class?
Entire final BDS students. Initially, when I started the project, sir, I had taken a few students. Later on, madam told me to include all final year BDS students. So I included
So
all.
you should talk about the inclusion of everybody.
Yes. Sir.
Okay, so method starts with a small group. You got success, and then you went into the entire final year students.
Yes.
So oral implantology was introduced in the undergraduate curriculum.
Yes,
The
sir.
challenges from the other faculties must have been plenty.
Yes, sir. Yes, sir. Because already the curriculum is packed, sir. Theory is done. They are not emphasizing on the practical aspect. So we are focusing more on the practical aspect, sir.
Yeah, that is true. That is what I'm trying to tell you, that if the challenges are so much, then implementing it on the national level in the curriculum would become a big challenge for.
Yes, sir.
Yeah. So you are also suggesting that apart from oral implantology, many more such topics should be introduced in UG curriculum.
Yes,
So
sir. Like
be careful.
Anand sir was saying, like lasers can be included as well.
So you be careful what all you are introducing in UG level.
Actually, sir, I took this study based on a gadget released by DCI, wherein they say that unauthorized training for implant programs shouldn't be there. So keeping that
Correct.
in mind, I thought I'll take an initiative, at least at my college level, then we'll follow.
No, good. It's a very good project. Congratulations.
Thank you.
But sir, he has taken a very big bite. He should have just done need assessment for now.
I know.
Done a robust need assessment around the region or the southern part of India or whatever it is. But he had already, curriculum making take a long time, but they made the curriculum also. So I told him to conduct a focus group. So he conducted a focus group. And then, only 3-4 faculty, like one from perio, one from surgery were involved. I told him nobody will take this project ahead if they are not inclusive.
Yes,
correct.
So that was done. Then only a pack of students were taken. So I told him at least expose them so that a larger group is exposed, and then you see this project cannot be taken further in this way. You may have
a
to
lot
start.
Of challenges. Lot of challenges from other faculties.
And
yes.
It is, sir, today people first ask the faculty, you can ask these 7 people over here, is it recommended by DCI? Management will ask. And moment they say no, is it inspector going to see that? They will not agree to even give time for the timetable. In the future, when the electives are included in the new curriculum, that time it is possible. Sir, they can now do small things, their own. If I am a second BDS teacher and I'm going to a preclinical, I can on my own bring some models and show my videos and show some charts, take them to the clinic sometimes to show the how the border molding is done and how the people are talking. So all these are early clinical exposure relating to interest sustainability. This is such a large bite, sir. What people would do for 2 years, 3 or 4 years, he has done in just through 3-4 months. So I let it go because let it be the project which cannot be taken ahead. There are certain projects, Anand project can be taken ahead. Meenakshi's project can be taken ahead. Sandhya's project can be taken ahead. I'm interested. Shilpa's project can be taken. I'm only interested in these 4 people who will contact me next year how to take it further. Other projects, sir, they'll have to start. Arun, I think, okay. In fact,
Let's
me
see.
and Arun were
Let's see
together
how
on
it
the
comes.
online for 2 hours. I told him I can't give 2 hours to everybody. Huh. So Siddharth, I'm telling you, just do need assessment. Even Meenakshi indirectly commented, sir, why don't you do only need assessment? Am I right, Meenakshi?
Ma'am, yes, ma'am. When he was presenting, I did say yes.
Anyway, it's okay. So if you want to start with this good idea, you have to restart Love All next year, okay? Then we will do it.
Yeah, madam.
Yeah. Okay, Siddharth.
Thank you, ma'am.
Yeah. Who is next? Shilpa.
Yes, ma'am.
Please take this project, whatever you have done, a little further. Next year, the conference will be in Mumbai.
Okay, madam.
I'll keep a special slot for all of you.
Okay.
But it will be selected from all the previous 30 and you. So I want to select about 8 projects. So please see that it is done properly. Sir, this project is extremely useful for narrative writing. You give your comments later. Okay. Okay, Shilpa.
Yes, ma'am. Good afternoon, everyone. This project titled Photo Voice, a qualitative data analysis by a participatory action research method. So what exactly is photo voice? Photos or
Where
the
is I can't see it. I can't see your slide.
Slides are not visible, Shilpa.
Not visible, ma'am.
No.
I don't know. Even the screen has become very... Share the entire screen.
Yes, ma'am. Now?
Yeah.
It is visible?
Yes.
Yeah. I don't want those photos of foreigners if it is there. Huh?
No, ma'am.
Whose photo it is?
It is just clipped from the Google, ma'am.
No, not allowed.
Okay.
You have such beautiful people in India.
Yes, ma'am. Okay, the photo voice. Photo voice is not something which is new in our day-to-day life. Photo is something which is being clicked every day, especially nowadays when we have a camera, mobile cameras in our hand. So in an average, we can see everyone is clicking the photos in a day, especially the Gen Zs and all. They'll be clicking the photographs like more than 100 per day. So why exactly we take the pictures? To make it as a memory or to show it as to some relatives or the friends, or we can use it as a project. So in this picture, what we can see is there is some amount of garbage cans which are there, but still the garbage is placed outside. So what exactly this photo is going to explain us? So this photo is going to explain that even though in an urban city, everyone is educated, well-educated city, the garbage is being disposed outside the container rather than the inside. So that exactly explain that even if we are aware of it, but we are not concerned about it. So until unless somebody address these issues, these things will not be, these might be looking very small or very small issues, but nobody is going to address this until unless somebody points out. So what exactly the picture explains? So the picture is something worth of 1,000 words. So how exactly we can use this as in our project? Photo-wise, it is a process in which people, usually those with a limited power due to poverty, language barriers, race, classes, ethnicity, gender, or the culture or other circumstances, use these images to capture and explain to the environment about their environment and experiences there and share them with the others. This concept was developed by Paul Freire. He's a Brazilian educator and a philosopher, and he pointed out the critical awareness of the theoretical foundation of education, that is the feminist theory and the non-traditional approaches to document the photographies. So this concept is being carried out by Wang and Burris in 1997, which was proposed as a participatory method for analyzing the photo voice data, which is called as voice, an acronym for voicing our individual or collective experience, and focused on the participants contextualizing and codifying the data. So this project is going to make this, why this project is being taken, to create the dialogues by discussing the groups about the photographs and influence the individuals or the group decision making, to motivate the students to learn his own environment and to make the notes or the record the strength and weakness of the surroundings. And it also gives the opportunity for the students and co-construct the meaning around the common experience or the circumstances among themselves. It also bring out about the changes that will improve the conditions and enhance the lives by reaching and influencing the higher authorities. Why we should use this as a project? So this project is going to actually give the children or the youth with a certain difficult circumstances. It is going to give the power. It also gives the power to the homeless or the adults or the families, people with the physical or mental disabilities or the mental health issues, or the members of the racial, ethnic, or linguistic, or the religious or the cultural minorities. So there are certain issues which will not be able to address, and even if it is being addressed, will not be taken care of. So in those cases, when we might use these photo eyes, when the photo eyes can change the people's opinion about themselves and the environment, when the group situation need to be addressed publicly, when the change is necessary. Who all can use? Sorry. This, what advantage can bring this method? Regardless whether they can read or write, the facilitates the sampling of a different social and the behavioral context, such as the place, the movements, or the ideas that might otherwise not be available to the health professionals or the researchers. Now, coming to the methodology. So this project is being carried out in 4 different phases. The first phase involves the recruitment and training of the students, then followed by the collection of the photographs. Second phase involves the one-on-one interviews, and then followed by the transcription of the interview which is being taken. After that, the display of the photographs which is being collected in the phase 1 is being displayed, and then followed by cross comparison and theorization. And then the final phase where the creative plan of action is being carried out. Now coming to the phase 1, where the 10 participants, 2 students from each, 2 students from first year to 2 students till interns is being recruited. So once the students were being recruited, the training is being given. So what exactly they are supposed to take, how exactly they are supposed to take, and what exactly they are supposed to address, whether any issues which they are going to face, which they are facing in a day-to-day life, how they can actually bring into the higher authority, notice to the higher authorities. So that was the main idea while I was giving a training to the students. So these were the 10 issues which is being highlighted and addressed by the students in the college. So before I make these these photographs, I was supposed to take the ethical clearance from the college, which was given by the ethical committee. So once they collect all the images or the pictures which is being selected by the students, there were some 4 or 5 pictures were being collected. But exactly what the student might feel that it is more concerned, that image was being selected. So that image is being the one which is being finalized. That I have made some of the questions which is being asked while the one-on-one interview. So these are some of the common questions which is being asked for all the 10 participants. And this is the voice recording.
Hair has been plucked off because there was a fire accident, and the powder which is seen on the floor shows that it was the fire was stopped by using a fire extinguisher, and then it happened in the department because of not maintaining it properly.
Why did you take the picture of this?
I took this picture because it was a surprise for me. When I came to the department, I saw that there's a smell coming, and so when we checked, it was a chair on fire. So to get the fire rid, I asked a few students to call the electrician so that he can handle it. But then by the time it was already late, one of the staff told me to use the fire extinguisher. But then later I realized that I don't know how to use it. Then the staff told me that pull the pin and press it. So with the help of that instruction, I stopped the fire.
So what does this picture tell us about your life?
So that we don't get confused or how to work with the situation. So we just need to be stable and calm.
And how can this picture provide an opportunity for us to improve?
First of all, we should know what instruments or the equipments we are using, and on top of it, also we should know that how it should be maintained, and then this can also help. Then this should also make a point that we are supposed to give a proper fire uh, extinguishing knowledge. Uh, Training, we should be properly trained. All the doctors and people around should be trained properly for the fire management.
Shall we start? So once the voice recording was completed, the second phase is the transcription. So whatever the respondent has given the answers, those answers were saved or typed or saved in the software, including the pauses or the number of repetitions of the words which is being said by the respondent. So after this, the text analyzer, which is one app which was available easily, but it was a paid app. This app provided me to analyze the text basically by the exact words which were being copy pasted, and it is being analyzed. So with that app, this was the result observation which is shown how exactly the student was able to respond, what is the speed of the uh, readability of the score, or what is that amount of words which were used with the repetition of the words, and what is the frequency of those words, followed by the word length distributions, how exactly the word has been distributed while the students was giving the interview. And there was one more thing which was highlighted, what is the highlight of the high frequency of the words which were used by the student. So after the observations, these were the some of the sentiments which was drawn by and highlighted by the students by the transcription itself. Those were concern and alarm, then surprise and shock, the frustration and helplessness, reflection and learning, and call for actions. The emotional tone which was being explained by the student was the urgency, the reflective, the concern, and the proactive. So after this, the individual image or individual issues which is being addressed would have been given some certain theories. So one image or the issues which was drawn highlighted around 7 to 8 hypotheses or the theories. So after the completion of the voice recording and the hypothesis, the same thing which was repeated with all the 10 students. And these pictures were with some certain catchy sentences were being displayed, and then it is being displayed in the photographs were displayed on the notice board of the department. So this has been observed and given considerations. What exactly our HOD given considerations? He was very keen to understand what exactly I was trying to explain by through the photographs. So not much of an explanation I had given, but it was only the photographs which were displayed on the notice board. So after this collection of all the words and all the sentences, these were the statistical analysis which was being drawn from all the 10 participants. So out of 10, some 23 hypotheses has been drawn from all the participants. So this has been narrowed down to 5 hypotheses. So these hypotheses, which is also called as a schematic analysis, which is being drawn, which is going to basically give us in which direction we are supposed to address the issues. So those were safety and risk management, health and well-being, education and awareness, community engagement, and infrastructure and design. So, followed by the thematic analysis, the issues were being put in front of the college authorities, and especially the one which were inside the department, the issues were being taken care. So, these were the changes which was being made in the department itself. There were certain issues which were required by the higher authorities. Out of 10, some 7 issues were being addressed. And these are the changes which were conducted in our department by the HOD of the department. So coming to the discussion, the participatory action research method is going to be effective only with all the 4 elements, that is the action, the participation, the research, which in turn is going to bring the changes. So the qualitative research focus mainly on the gaining insight and understanding about the individual perception of an event and the circumstances. There are a number of other qualitative research methodology, but the action research methodology, participatory action research methodology was more effective as compared to other type of qualitative research. So this project is going to make the student to got motivation to learn his own environment, and it has been increased the self-confidence in among all the students and increase in self-evaluation, understanding of their circumstances in students, and encourage the critical consciousness. So the gaps and limitation of this study is basically ensuring that the ethical issues are discussed with the participants at the time they were briefed and trained in the taking the photographs. So ethical clearance basically means when the students who were able to take the pictures, there should not be any images of the face recognition.
Last 15 minutes, you all given 8 to 10 minutes.
Yes, ma'am. The qualitative data analysis interview was quite difficult to conduct. Conclusion on the PhotoVoice project outlines the various hypotheses and theories related to emotional response, safety, resource allocations, and community health in a different context, particularly emergencies and healthcare communities. So the implication of this project is it is effective only all the 4 components requires equal and critical considerations in the ways we plan and implemented our projects. These are the references. Thank you. And this is the poster.
Sir, can you comment?
Yeah, full compliments, madam. I'm thoroughly impressed by the
Sir,
project.
yeah, I have some questions again.
Wait, I have one observation to make, because this same project which we had done about 5 years back, given it to undergraduate students, but it was not called Photo Voice. We had called it the Photo Speaks. So Photo Speak was the title given, but it was given as a hobby project for students, but never taken as a research project. That is why I'm impressed that this has been converted into a research project, and I'm sure this will have because as you rightly said, storytelling and narration is something which every student must imbibe in this undergraduate level only. So if you can impress upon him about the narrative experiences that he has about anything, this is only photo voice. It should be about patients. It should be about descriptions, everything. So narration is a very important area which is covered to a large extent in this project. I'm very happy about this project, madam.
Yeah, but it requires, Shilpa, a little more standardization. You took a group of people from all the years. First to the, please close your mute yourself. Even today they are keeping it on. So you took one group. You should have taken 4 groups like that, I had told you. And the same picture, the entire group discusses. Because see, the same picture will be interpreted by me separately, somebody. And you said photo voice is very, in the introduction, common. Photos are common, man. Photo voice is different. And secondly, same picture was not given to people. Still, you have conducted the statistical analysis because you said, okay, it's a generalized statistical analysis of alarm or risk involved, or maybe some urgency or something like that in every picture. But all the 4 groups should have, if you want to take this project for publication, there should be 4 groups. And then 4 groups, they should be having the pictures which are same, 4 pictures which are same with a proper marginalized people in the society. That is what people started photo voice for. When you see a person, when you see an elderly, you otherize him. You feel वो बूढ़ा है, मैं कभी बूढ़ा नहीं होगा. तो उसको पॉलिसी करो. उसको पॉलिसी नहीं करना है, उसको एम्पावर करना है. तो he has to take care of his health. Or government policies don't work. So photo voice is an effective method provided, and again you didn't make a change in that PowerPoint where your photo. It is not your photo. It's the photo in your hand. Photo. Why your photo, man? I will take it as Suhasini's photo. In that, see the photo, describe the photo. Then you didn't make the change. Last time also told the same thing. And see, if it is to be published, no, then we have to have 4 themes. One is that gas burner is very good. Like that urgent public theme, you even spoke about that wheelchair thing. All those things can be made into 2 projects. And what everybody says, photo voice, and what, see, there are 2 parts to it. One is narration. So everybody doesn't see the same way I see or you see. So you're training them for that. Second is, you said the pitch of the voice. Very good. That software detected it. Yes, ma'am. So you need some standardization. If it is standardized, no, it can be not only published, it can be presented. Sir, I remember that photo speech. Sir, इस बार NCHP में there is a project on photo speech. Photo voice, I'm sorry. Photo voice.
Now, what we had done in that is same one picture was shown to 5 different kinds of strata of people, and we tried to understand what each one understands from their perspective. So the photo should speak the same for all the 5 different types of people. Then that picture is a good picture, which talks about.
Sir, but the photo will not speak. I will see what is I want to see.
Well, that perception about the photo should be more or less similar by different types of people. Right from the patient to management.
Sir, her project was whether this all can be highlighted and brought to, she said, higher authority, which I didn't like. I told her to change last time also. It can be taken as a social cause. I can make some changes. We can make some changes. Dean can make some changes. It's not higher. Who is a higher authority? One who makes the change is the higher authority. Yes, ma'am. So don't use such words as higher authority, your picture and other things and all. And photo voice is common. No, we all take photos commonly. But have you ever?
Voicing it is not very common, correct?
Yes.
चलिए आगे बढ़ते हैं.
Next, Sandhya.
Yes, ma'am.
Yeah. Shilpa, you have to reduce your introduction talking, and also the introduction also can contain some clip art or something like that. It's very dull and only black and white. And you can't have 15 minutes. They will put a bell. There are total 20 minutes. Hua. Sandhya, 8 minutes only, na?
Yes, ma'am. I'll try to finish it fast. Is my screen visible?
Yeah.
The project title is Assessment of Postgraduate Education Environment. assessment of postgraduate education environment in Government Dental College, Kottayam, using modified FEAM questionnaire. This project is being guided by Dr. Suhasini Nagda, Dr. Chinmay Shah, and Dr. Gaurang Bakshi. Coming to the project problem statement, all of you know that educational environment has a significant role in any education as such. And it is very critical for postgraduate medical and dental education. Why? What is the difference of a postgraduate education, medical, dental, compared to other normal colleges? The difference is that you are treating a patient. So there should be a balance of education and service. So the service to humanity aspect comes there. Learning environment as such helps us to understand what is the education climate and academic culture. Each institute will have a particular academic culture. GDC Kottayam has a particular academic culture, which is not similar to other GDCs in the state of Kerala, nor with the other institutes in India. As such, it is very complex and multifaceted. Why is it complex? Because you have different parameters there. You have the mentor help, you have the learning scope, you have the student attitude, you have the clinical evaluation. So many parameters are there to understand the learning environment. And if we have some measure, some questionnaire or some form to measure the educational environment, the institute or the college or the university can improve on that. And they can understand what is happening and they can improve on the deficiencies and come out excellently. This assessment provides a holistic, comprehensive and systematic and detailed picture of the overall state of affairs in an education process. So coming to GDCK Kottayam, here we have MDS in all the 9 specialities, and the PG is for 3 years. So we need to assess the first year, second year, third year separately. And we assess the students, we'll be able to understand whether the training program which we are imparting is a successful or not. No study has so far been published with this regard in the state of Kerala in the government sector. So coming to the objectives, we
don't put this at a context. Context is the need. It is not.
Okay, ma'am. So I'll correct that. So coming to the objectives, we have a primary objective is to evaluate the postgraduate education environment in GDCK Kottayam. Secondary is to compare the postgraduate education with respect to gender, years of residency and departments. Methodology, study setting is postgraduate departments of GDCK. Study design is a descriptive study. Study participants, the currently available 3 groups, that is the 21-22, 22-23 and 23-24. Sample size and sampling data is collected from the entire sampling frame. Coming to the description of the data collecting tool, the questionnaire which I have adopted is the FEAM questionnaire, that is the Postgraduate Education Environment Measure given by Roff et al. I have modified the questionnaire to suit the educational environment of GDC Kottayam. The first part of the questionnaire consists of demographic variables. The second part of the questionnaire, the variations I have made, minor modifications only I have made. For that, the procedure adopted is that original FEAM questionnaire was given to 6 experts from 6 different departments for initial assessment. They were asked to go through the questions and give any modifications for the 40 items. This original FEAM has 40 items to that. The first round of the survey revealed that few of the individual items had sufficient score, but the universal agreement score was less than average, the required one. So, based on the suggestions given by the experts, adaptive modifications of the FEAM items was done. And again, the modified questionnaire was given to the experts. And again, content validity index was measured and the universal agreement score was increased to 0.83, which is acceptable. Coming to the ethics approval was given by the ethics committee. Then approval number is this, and written informed consent was obtained from all the participants. Statistical analysis, SPSS social package 21 was used. Descriptive statistics like mean, median, standard deviation was done. Unpaired t-test and ANOVA was used for parametric quantitative comparison. Significance was set as p-value less than 0.05. Reliability analysis of the modified FEAM was additionally done with Cronbach's alpha coefficient. So coming to the interpretation of the data, the 40 items were given to the participants and they were asked to score it based on the Likert scale, that is 1, 2, 3, and 4, for strongly agree, disagree, and strongly disagree. The total score as such, there are 40 items. So this 40 items maximum score what we can get is 160. So based on that, 4 divisions are given for the interpretation. First 40, it is very poor. 41 to 80 is plenty of problems. 81 to 120 is more positive than negative. And 120 above is excellent. So that this is for the total score, the overall score. This overall score is actually a combination of 3 separate domains. The domains included are the perceptions of role of autonomy, perceptions of teaching, and perceptions of social support. Again, role of autonomy, we have 14 questions. Out of the 40 questions, 14 questions fall into this domain. And accordingly, we have 4 different gradations for that, very poor to excellent perception. Again, for teaching, 15 questions are there. There also from very poor to model teachers, that is 4 interpretation domains levels are there. And also for the perceptions of social support, again, it is 11 questions are there. So based on that, 4 gradations are there. So this is how the total score and domain scores are being evaluated. Coming to the results, demographics, we had 78 students, only 77 responded. So the score, the questionnaire response rate is 98.7%. Some departments, 5 students are there per year. Some we have only 2 students. So it varied from 2 to 5. Coming to the gender, 62 females and 15 male. So that is around 80.5% and 19.5%. Girls are more. Coming to the scores, the total, the global score, what we obtained for our institute is 130.81 plus or minus 14.27. That is the standard deviation. And this score, according to the Roff et al. For the total score analysis, it is in the excellent level. That is when we look into the total score for the 4 different gradations, it is in the excellent level. And each of the domains were again measured, and the domain scores, all the domain scores were on the highest level. That is for the role of autonomy, it is from between 43 and 56, 45.36 we got. And for the perceptions of teaching, 50.21 for between 46 and 60, which is in the model teacher level. And perceptions of the social support, again 34 to 44 is the range, and it was in the within the range but on the lower level. When we look into the data for the junior residents, how many of them opted what? It is an interesting finding. What I got is that each domain we have, I already said, there are 4 interpretation levels, and the students opted for the last and the highest 2 interpretations levels only. So the students were putting it, or they are grading it on the higher level. Coming to the scores with respect to gender, the total score comparing the male and female, females graded the atmosphere or the environment better for the total score as well as the domain score compared between male and female. The next is the year of residency. When we compare the first year, second year, and third years, the third years were giving a better assessment, or the better score for the environment compared to the first years and second years. But when we compare the first years and second years, for except for the role of autonomy, the first years were better. They better in the sense they gave more positive to the environment than the second year. Probably the second years gave better for the role of autonomy, could be because as the year goes on, they are more confident with their clinical expertise, and because of that, probably we got a better score. and comparing the different departments and the scores, all the departments, the scores were on the highest level, excellent level, but we got a statistically significant differences. The difference was between the lowest and the highest. So it was between 120.89 and 120.78 and 141. That was the highest. So that the significant difference was between these two, or the highest and the lowest departments only. When we compare the interpretation levels with respect to the departments, already I said that the students responded for the last or the highest two was between these two, or the highest and the lowest departments only. When we compare the interpretation levels with respect to the departments, already I said that the students responded for the last or the highest two levels only, that is more positive than negative and the excellent, and these are the percentage of students or the percentage we got. So some departments we have 100% which is falling in the excellent level. Few negative questions are there in the questionnaire. What I want to say in this with respect to negative questions is that we have not got 100% disagreement for the negative questions. We have got agreements like for 11 to 11, that is 10.4 to 33.8%. So there is a difference. Still, there are some gray areas. Even though the excellent, we got the excellent score, the negative questions are giving a more indication to the gray areas. And one question, there is 100% agreement. That is the question number 31. So coming to the conclusion, modified PHEME questionnaire used in the present study has a set of items adapted from the PHEME for measuring the educational environment within the dental postgraduate educational environment. High compliance rate of filling the questionnaire implies that the junior residents found it simple and practical. It is also shown that the modified PHEME meets the requirements of assessment tools, namely reliability and practicality. The mean total score obtained in the study was 130.87, indicating an excellent interpretation level. And the subscale scores were also on the excellent perception of one's job pertaining to role of autonomy, model teachers pertaining to perceptions of teaching, and good supportive environment pertaining to social support. Female junior residents ranked the environment higher than the male gender. Third years ranked the environment highest compared to the first years and second years. Statistically significant differences was observed in the total score with respect to different departments. For the interpretation level, the scores were in the top two levels, that is more pros than cons and excellent, for which majority of the departments were in the top level, indicating an excellent learning environment. Implication: the study helped to identify the strong and weak areas in the learning environment. Items where mean score between 2 to 3 are areas where climate can be enhanced. Negative questions are not 100% disagreement. Even though the overall PHEME score is in the range of excellent, there is a need for further improvement. These are my references. Thank you.
Poster.
Yes, sir.
So till the time it's getting open, can I make some comment?
Poster is not visible, Sandhya.
Yes, sir.
Maybe you can double click on that PPT. It is not visible.
She's doing it, yeah.
second, I'll share once again.
Sir, please make a comment till then.
That's what I was trying to tell Sandhya. Oh, it's come.
There is it seen, sir?
No.
Yeah, you can minimize it. Yes. That's okay. Education environment,
see
many people
properly.
have done. Madam,
Yes, sir. Yes, sir.
you're saying something?
Keep the poster on. We are not seeing it. It was too big initially, then it became
Usko
small.
minimize, please minimize it.
Is it
Show the
visible now?
No,
No, madam,
original
not
space.
visible. Zoom it out, madam.
Zoom out करो उसको.
चिन्मय ऐसा पब्लिक क्यों रखा? चिन्मय?
Madam, that will discuss afterwards.
Is it visible now?
No.
No, it's
Now
Is it
visible.
Yes.
it's okay.
Okay. But tables and data still can be graphically, it would be better.
Yes, ma'am.
Yeah, okay, doesn't matter. Acha, Sandhya, sir, before you ask a question, I want to genuinely ask one without any bias and out of record. Nobody's recording. What is of the academic environment in your institution? Is it that excellent teachers? And
Actually, I was thinking there is few are there. Also, students have come and there are some the college. So that is the reason I started, okay, let me just go ahead.
In the college, by you as a faculty, the
Yes,
students will only give a very neutral answer. It should be conducted in something. Otherwise, theme is actually to create a change in the environment and not get excellent results because things are not excellent everywhere.
No, ma'am, I know.
If there are 10 or 12 faculty who can have problems, other 2 faculty may not be regular. So, I told you when we used also that you need to modify it as per our requirement, not medical. The theme was made for medical. The number of hours and other things and all. Yeah. And the teaching for MDS in the dental colleges. There is no formal teaching as such. जो भी थोड़ा सा hidden curriculum होता है वो. Siddharth and Rohit, they'll know better.
Pardon me, madam.
Yes, Madam is asking regarding hidden curriculum.
He nicely said,
Ma'am, so many things are there hidden only, ma'am.
Yeah, I understand, Rohit. He nicely said, when the demonstration is given, it is given once, that's all. It's not everywhere, but 80-90% it is like that. You ask Anand, he may not agree. You may be giving several times, no, Anand, in Belgaum? I hope so. When I had come, it was like that.
Yes.
I don't know.
And even, ma'am, sometimes what happening, they are telling, they will learn in the PC, why to teach in UG also. This is also happening.
So actually, do you realize this is a very important study? So please think of making your own questionnaire now. And you don't put it. Let us put it as a third party by somebody. We'll think about it. I mean,
Yes,
if this is the answer, it's a biased answer.
Yes, ma'am.
Okay. Sir is asking.
No, no, I was just making the same observation what you were making. Assessing the educational environment by a faculty will always have some amount of bias. So there has to be some amount of quality assurances, quality analysis of the questionnaire which you make. And using the already existing questionnaire for testing the educational environment of Kottayam will not work. You have to make a fresh questionnaire based on the requirements of the Kottayam Dental College. That's what I feel.
I think we all
because
7 of us can get together along with Dr. Chari and Chinmay and Gaurang and make a robust questionnaire and don't send it. I will see that it is sent to everybody as a third party. Some medical person conducting. Chinmay will send it or something like that.
But one interesting factor, madam, which comes out of her study is more the number of females, better is the educational environment.
But that's true, sir.
That's true. That's very true. 68%, 68 faculties were residents were females in her study.
Yes.
If
They're
you see that
everywhere.
only
Everywhere
12
it is.
were. Yeah, it's the same thing.
Everywhere.
Chalo.
Sir, the men want to take a profession where it gives you jobs, sir.
Anyway, chaliye aage बढ़े.
Yes. Ma'am, shall I? Yes,
yes,
ma'am.
yes.
Yes, ma'am.
Arun, you got up now or what?
I'm out of the screen, ma'am. Just got into the screen.
Yeah, that's what I'm saying. I thought he was having a small nap before you joined.
Ma'am, are the slides visible?
Yes, yes, it is.
Yes, ma'am.
Yes, visible.
Yes, ma'am. Yes, thank you, sir. Good afternoon, everybody. The title of my project is Need Assessment on Knowledge and Understanding of Dental Students on Diet Counseling for Geriatric Denture Wearers. So this project has been guided by Dr. Suhasini Nagda ma'am, Dr. Chinmay Shah, and Dr. Gaurang Bakshi. So as we are all aware of that the world is graying and so is India. By the end of 2025, we'll have 25% or more of geriatric people who will be the percentage of geriatric population would be increasing by 2025 by around 25%. And we being prosthodontists are actively involved in giving rehabilitation for such geriatric patients who have no teeth. And we are actually directing ourselves for oral health and oral rehabilitation, which obviously leads to overall health or overall well-being of our geriatric population. Now, having said that, the dental team must also be more aware of their potential negative effects of dental treatment and providing nutritional counseling to counteract them. Because we are all rehabilitating our patients, especially patients who have no teeth with artificial substitutes, we should also be taking care of their nutritional counseling or diet counseling as well. Hence, why is this intervention needed? As we are all aware of, that poor oral health and decreased ability to chew the food among geriatric denture wearers mainly leads to lack of nutrition or directs themselves to malnutrition. Hence, nutritional status assessment becomes imperative to offer timely dietary advice to our geriatric population. And there is also a lacunae or lack of awareness on dietary counseling rendered by the undergraduate students who are actively involved in their final years and internship in the fabrication of complete dentures for such geriatric denture wearers. And are we definitely giving a balanced diet for our complete denture patients after rehabilitation is a question which needs to be assessed, because giving a balanced diet for our geriatric patients is a non-invasive and low-risk benefit. And hence, we can make it mandatory that nutritional assessments and nutritional counseling or diet counseling to be a part or mandate for undergraduate clinical training. With this small little background, so the aim and objectives of the present project is, the aim of the present protocol was to evaluate the need assessment of dietary counseling or nutritional counseling among undergraduate students and interns for geriatric denture wearers. The objectives being to raise the awareness of the need for knowledge and practice of nutritional counseling among geriatric denture wearers in dentistry as a tool to achieve productivity and improve quality of life, improve the attitudes of the students and the interns towards nutritional counseling, and implement a positive interest among students in improving the patient care through nutritional counseling, which actually fits to the SDG 3, that is Sustainable Developmental Goal number 3, that is good health and well-being. So the methodology is a cross-sectional survey was conducted among final year students and interns of JSS Dental College and Hospital from March to August 2024. A questionnaire was fabricated with 41 questions, which was pertaining to the knowledge component, which had 28 questions. 9 questions addressed the attitude component, and 4 questions addressed the barriers. What was the actual barriers which lacked their nutritional counseling for geriatric patients? The correct response for knowledge was scored as 1 and incorrect as 0. This questionnaire was circulated among the final years undergraduate students and the interns through electronic media, that is the Google form, after getting the approval of ethics committee of JSS Dental College and Hospital. So a convenient sampling of 127 students, the Google form was circulated, which included 46 final year students and 81 interns from the batch of 2020 to 2023. So this was the ethical clearance which we obtained. And the data quality assurance was also checked for clarity and validity of and completeness of the questionnaire. We also conducted the validity and reliability of the questionnaire, with content validity being established by a panel of 4 nutrition experts from Department of Nutritional Sciences, from Faculty of Life Sciences, JSS Academy of Higher Education Research, and 4 from the Department of Prosthodontics, JSS Dental College and Hospital. We could get a Cronbach's alpha of 0.78 value, indicating an acceptable internal consistency among the questionnaires, suggesting that the items are moderately related to each other. Having said that, the statistical analysis was also done with the data which was analyzed through SPS version number 2022. Descriptive statistics were done as a number and percentage was calculated to summarize the quantitative data. Chi-square test was used to find the association between the variables, and a p-value of less than 0.05% was set as statistically significant. So coming to the results, this is the Pareto chart, which actually gives us the broader view of the knowledge requirement pertaining to the recommended dietary allowance or recommended dietary allowance, which is actually required for geriatric denture wearers, and what are the level of knowledge among the students who were assessed. So we can actually see a gradual decrease or the dip in the level of knowledge pertaining to all these questionnaires which were addressed through the Google form. So less than 50% were actually able to identify what is the actual dietary requirements for geriatric patients, especially our geriatric patients, which actually fits to the ICMR guidelines. And when questioned regarding to the nutritional counseling, whether they were providing, they were actually 50%, the responses were 50-50. And when compared to gender, female, as suggested by most of the studies, the female participants were more when compared to males. And when questioned regarding the right proportions or the right, as per the ICMR guidelines, how many of them were actually giving the right proportions of dietary requirements after rehabilitation, we had around 57 who were actually saying that they were not knowing or not aware of. And when questioned that whether they were assisting the patient setting the goals regarding improvement of diet for the particular patients, around 54%, that is more than 50% were said that they were not actually involved in giving the nutritional or dietary counseling to the patients. And as we are all aware that ICMR guidelines have broadly classified the dietary components as the vegetable fruit group, bread and cereal group, milk group, and meat and protein group, which actually fits for our geriatric population as well, especially after rehabilitation with the dentures. So we should be in a position to guide our geriatric population after rehabilitation with the dentures regarding all these 4 components as well, 4 groups. So after rehabilitation, the geriatric patients with the dentures, and as soon as we rehabilitate, whether the patient is a first-time denture wearer or a previous denture wearer, we should be in a position to identify and give them correct guidelines regarding the lack of nutrition and how they can improve their nutritional requirements. So we got to know that there were 50% knowledge regarding among the interns as well as the final year students, but not up to the mark. Sir, are the slides visible, sir? Hello?
Yes, ma'am.
Yes. Okay.
Yes,
so when
it's visible.
Second post-insertion day. Yes, sir. Thank you, sir. So as we are giving the rehabilitation with the dentures, we should also be in a position to evaluate what they're having the balanced diet during the course of time after rehabilitating the patients with the dentures. So as soon as we get the dentures, it is not the protocol that we neglect how they are actually eating. So we should be in a position to even assess after rehabilitating the patients with the dentures on the second post-insertion day, third post-insertion day, and way forward. So even after assessing, we got to know that most of them were giving right answers, but not up to the mark regarding to the vegetable and fruit group, meat and protein group, because we get a mixture of population. There are vegetarian diet as well as non-vegetarian diet. So our students should be in a position to guide our patients to have a balanced diet on all the subsequent till the geriatric denture wearers are being assessed. So regarding the milk group, most of them were aware of, and bread and cereal group also, that they were unaware that what kind of diet has to be prescribed the day afterwards, after dentures has been given to the patients. Regarding the third post-insertion day also, people were giving the right answers, which is demarcated in green. So, but even otherwise, they were not actually knowing how the sequence has to be followed as per the ICMR guidelines. So when questioned regarding the barriers towards nutritional counseling, the questions were the diet counseling time constraint. Around 45.8% were actually did say that it was time constrained, and dietary guidance is limited by patient compliance. Around 47.9% did say that they were the patient compliance also matters a lot. Lack of confidence, this is one thing which actually is the thing which has to be highlighted. Around 40.6% said that they actually lack confidence because they're unaware of what are the nutritional requirements for geriatric denture wearers per se. And diet counseling is limited to reimbursement. If at all, if we are referring to a dietitian or a nutritionist, will they require a reimbursement? Do they require a monetary benefit? So they actually, the students did say that 40.6% might require, that could be one of the barriers for diet counseling. So coming to the attitude component, when questioned regarding how competent are they to give dietary advice, only 31.7% were strongly agreeing that they could give nutritional guidelines or dietary guidelines for geriatric denture wearers. So regarding the association among the qualification between interns and final year students, there was statistically significant difference with regard to whether they are assisting the patients in setting goals to improve their diet, and do you provide nutritional counseling? Of course, interns gave a better response when compared to undergraduate final year students. And the same holds true when the association was made between the interns and final years regarding the ICMR guidelines for vegetable fruit group during the first post-insertion, second post-insertion, and the third post-insertion day. Interns had better knowledge over the final year students. That was statistically significant. When compared to the attitude component, when questioned regarding whether the dental curriculum should include a strong emphasis, it was a statistically significant association which was found between the interns and final year students. And when questioned regarding whether it is imperative to integrate nutritional guidelines or dietary guidelines into standard dental practice, there was strong agreement between the interns and final years, which was having a p-value of 0.05%. And when questioned regarding patients who develop physical indicators of malnutrition, if at all, during their case history record, which is actually not, and referred to the nutrition or a physician is mandate, most of them did agree that there was strong requirement, and it was statistically significant among the interns and final year students. So statistical analysis reveals significant gender disparities where females are significantly more likely to provide nutritional counseling when compared to the male. Is a higher recommendation rate for counseling for consulting a healthcare professional, especially a nutritionist or dietitian, when found that there were nutritional disparities among geriatric denture wearers. And the significant differences also include the perception that diet counseling is time constrained. Most of them did say that it is time constrained, and there is lack of sense among the students were also the positive indicators or positive evaluation which we could notice in our study. So interns are more likely to provide nutritional counseling to all the denture patients and assist in setting the dietary goals when compared to the final year students. And significant fact, they believe the dental curriculum should emphasize nutrition, and a referral to a physician for signs of malnutrition was also the need of the hour. So elderly people are more likely to face malnutrition, which can provide a way for many others. So patients with edentulousness are more, because we, after providing dentures, dietary guidelines for such patients. And the dentures affect the nutrition greatly, as some people avoid the balanced diet, which most of the ICMR guidelines actually propagate that balanced diet has to be followed. For diet is very important to acquire adequate amount of nourishment. So professionals from various fields have stressed the importance of diet and nutrition. And there are some of the studies which was done in India, but best of our knowledge, there was no study which has explored the differences in the level of denture malnutrition knowledge among dental students based on their year of study. So implication as a team should come together, especially the policymakers, professional bodies, public health professionals, we academicians, oral healthcare professionals, nutritionals, and not to forget even our patients, which are our stakeholders, should come together to improve the nutritional and oral health status of our older adults, because that is the need of the hour. So these are my references. And what are the outcome indicators which we could raise as a part of our project was to appraise the awareness of the need for knowledge and the practice of dietary counseling among geriatric denture wearers in dentistry, where a workshop was conducted for the students to gain the knowledge on how dietary counseling can be made a part of their denture curriculum as well. That means that after delivering of the dentures, how dietary knowledge also has to be imparted to patients. So improve the attitudes towards nutritional counseling for identification and avoiding of the risk factors in dental practice. So these were the outcome indicators of the part of our project. And to implement a positive interest in improving patient care through nutritional counseling. So as a part of Prosthodontist Day, we also did a workshop for our geriatric denture wearers, where nutrition is also given as a lecture series for them, and also to highlight what is the importance of good nutrition and balanced diet after wearing dentures. So as a part of our project, we also could attract an STS ICMR project in 2023, and we could get the result was B+. And the topic was to investigate the relationship between nutritional status and oral health related quality of life among geriatric denture wearers, which was an observational cross-sectional study which was done among geriatric denture wearers per se. So this was after rehabilitating with dentures, and what was the requirement and what was the lacunae which actually lies, which has to be addressed through our students before they could rehabilitate the patients with dentures. So there was one scientific publication which we could publish, and this was just a review article which could attract, that was the improving nutritional status of elderly patients with the dentures, which was circumventing the challenges. And we could also attract a best oral scientific presentation. This was in 2024 February. So as a part of this project, we could also culminate in identifying or development of a pamphlet, nutritional pamphlet, which was identified as best practice from our department. And this was a pamphlet which will be circulated for all our geriatric patients after rehabilitation with dentures from our students. So this is done in a local language per se, our Mysuru district. So coming to the culmination of our project, which could taper down to a Kern's model of 6-step model. So we identified the problem, that was a problem statement as identified, where the nutritional knowledge or the dietary knowledge has to be implemented from the students to the patients. Need assessment was done. We could achieve the goals and objectives. We could set the goals and objectives. And the strategies was actually planned, but what is actually requirement is the implementation and evaluation of this nutritional guidelines. So that is the need of the hour, and that is the future projects or the prospects of our project. So this is the poster, sir.
Okay. So you basically were doing needs assessment on education, on
yes,
knowledge and understanding of dental students.
Yes, sir.
And you
whether
picked
they're
up
aware
only...
of nutrition and dietary requirements, which they have to provide for geriatric denture wearers.
So there was there is no interventional study. There is no lecture
no,
giving in. No,
sir, no, sir.
Nothing.
So that
nothing
would be
as
the
such.
second part of my project.
The second part of your topic. Now you are comparing interns and final year students only.
Yes, sir. Yes.
And you found that interns were much better than final year students, correct?
Yes. Yes.
Now in final year students curriculum and interns curriculum is the same theoretically.
Yes. Yes,
so
sir.
Why was this difference found in interns?
Probably they had their self-knowledge. Over a period of time, they could identify and they could understand that would be the requirement after rehabilitating the patients with the dentures.
How much is only 6 months later on? No, difference
yes,
between
sir.
final year students and interns is only 6 months to 8 months.
Yes.
So,
but even
so in that 6 months, you found such a high jump of knowledge level of interns.
It is not quite a disparity, sir. But even otherwise, also even interns' knowledge there was lacunae, but not that they knew everything regarding ICMR guidelines. But they had a fair idea that is the need of the hour. They need to give dietary counseling after rehabilitating patients with the dentures. But the final year students were more concerned with their completion of their quota and all that. But the glitch was that they were actually, though they knew, but they were not implementing it. because this is a part of the nutrition requirements is actually part of the curriculum, but they're not taking it quite seriously. So that was the thing which we identified.
So the final year students are not taking it seriously. The same final year students becomes interns, no, afterwards.
Interns. Yes, yes.
So level of knowledge for the level of knowledge is same for interns and final year students.
Exactly. So, so what we could think was we could conduct regular workshops on how the
Correct. So I think that would have been better. You conduct a workshop in the second stage, an intervention can be done, and then you can compare the final year student with him.
Yes, sir. Yes, sir.
In fact,
Okay, thank you so much.
Students listen to you better than the interns. Interns are free birds.
Yes, sir. Yes, ma'am.
And
Ma'am, I feel the confidence level which the interns will have better than the final year students.
Yeah, but
Yeah, that's true.
we also know there are various stratas of interns.
Yes, yes, ma'am.
That is one thing. And secondly, when you're talking about nutrition, there are a lot of people who have all facilities, the economics, everything is good, but they're not able to eat because of the issue of the denture. So
Yes, ma'am.
that also you have to include in the study further
Yes,
as
ma'am.
to the chewing ability.
Correct,
I'm
correct.
not telling you to exactly measure
Yes, ma'am.
the strength and all, but the patient can also talk about, see, there are patients who are telling me that they are not able to eat anything, so they take out the denture. And so they have not made an attempt. It's like a hearing aid, what they don't use at all. If they don't use it, is going to echo. And the denture is not used, it's going to be problematic. And the expectation of the patient. So all these things also should be a part of it. If that's good food, and I mean good food means the nutritional food, and they're not able to chew it well and eat it well, then it is affected.
Correct. Maybe we can think of a qualitative study, ma'am, from patients also. What are the
You need to gather data. What is it? Like the patient ke paas. Everything cannot be here. Arun.
Madam Meenakshi has to take this forward because this is only a needs assessment. It has to be taken forward with
Yes,
an
sir, yes.
interventional study.
Many of them will take it forward, sir.
Yeah. You can't leave it here.
Modify the question as per need.
Yeah.
Yes, ma'am.
Okay.
And we'll make it into a national project.
Yes, sir.
Lot of things will come out, Sandhya. And Shilpa will also do it. All of them will do it, sir.
Yes.
All, I think,
Yes.
Rohit, Siddharth, Anand, Arun, all of them have. Yeah. Okay.
Sir, the best part is all the projects are, we can say, unique in their own nature.
Correct.
Sir, they have not standardized because they also have lack of time and there are so many other things. That is why.
No, the projects are very good, madam. Let's hear
Projects are
Arun.
very good, but there are certain things required to make the parameters robust. Take only a small morsel and not completely what you cannot eat and half comes out. So all these are the issues, and not adapt the questionnaire just like that. And even the poster presentations, you should give a link. If there is a code, आजकल तो Gpay में वो code करके तुम पैसे दे देते हो. So you make a code, people can scan and see your questionnaire. They can't?
Yes, ma'am.
Yeah, or give a link, man. Give a link, that's all. Don't even give
code. Maybe QR
Ma'am,
code.
we can incorporate QR code.
Yeah, that's what I said.
Yes.
And some important questions should be there. But if the morsel is too big, then you have to think about what to include and what not to include. And nobody stands before a project which is completely black and white type. Nobody sits in front of a PPT where the person is talking from the PPT and it's only written matter. Some entertainment to the eyes also should be there. When you're talking about photo voice, it has to be that, not that what photo voice will go can be in a clip art or in a written, small written, but it can be in a graphic form. And the one more thing is, the person talking, what is he talking about? I should see the picture as an audience. So half of the slide should contain that and half slide should be the photo. And see, Shilpa, your project is different than that photo speak. I agree. But here, to get the photo, Wikipedia, look at the Wikipedia regarding what photo voice is. Look at these other meanings of dictionary meaning of photo voice. Some of them, they're very varied actually. In education, we are talking about, I'm not saying the same picture, but the same picture interpreted by different people may be different. So we have to train them to see important things. That is one part. Second is, when I say that the gas burners were just all the tubes were all very close to they can catch fire. So my pitch goes up. That is your software is recording. Yours is different than just a photo voice. You have a scope. That's why again and again I'm telling you. See, if your postgraduate students don't listen to you, you also must be just letting them go and signing it. That's why our projects don't get published. For publication, there has to be a robust standardization. We can't call any study randomized control trial. Please don't call them. First and foremost, people ask randomization table. You selected odd number and even number. That is not randomized. Okay. Arun, 8 minutes, huh? 8
Exactly.
to 10. Because now 4 o'clock. Because generally you present very long.
I'll try to concise, ma'am.
10 minutes ke baad I am off. Please.
At my place, it is 11:30 in the night.
Sir is 11:30. Sir is from New Zealand. Today, everybody is enjoying some Bhau Beej in Maharashtra. Somebody is out in Vietnam. All education is sir out. Sir agreed. Of course, the sir was the first person I approached. And he agreed long time back when I was in Australia. I came back to India, then approached many people. Sir, सगळे कुठे ना कुठे तरी फिरता ते. Okay, Arun, make it 10 minutes.
All right. Good afternoon, everyone. I'm going to present my educational project on need analysis to determine preclinical exercise duration in the first year MDS. I was guided by Dr. Suhasini Nagda, Dr. Chinmay Shah, and Dr. Gaurang Bakshi. The background of this study is preclinical exercises are crucial for MDS training as they are required for developing fundamental skills subsequent to the clinical practice. In addition, all clinical procedures are complementary.
I can't see your slide, huh?
All right, ma'am. I mean, is that visible now?
Yeah. Show us the first slide, please. First one. Title, yeah. Need analysis to...
Take that pre down, Aruna.
Yes, ma'am.
Let the preclinical be together.
All right, ma'am.
And the way you write the title is the capitalization of every first letter except the pronouns.
All right, ma'am. The background to this study is the preclinical exercises are crucial for MDS training as they develop the fundamental skills needed for the clinical practice. In addition, all these clinical procedures that we do subsequently in the second and third year final MDS are complemented by the respective lab procedures, wherein a student gains confidence in treating a patient comprehensively. However, there should be a right mix of preclinical exercise so that an early transition to the clinical can lead toward knowledge integration and enhance students' participation and motivation during MDS PG program. The problem statement here is, why is this intervention needed? Specialization in dentistry, like any other medical subjects, requires intense understanding of the subject and requires to handle challenging clinical scenario post MDS. As we all know that the graduate in dentistry is already a clinician, has got a sound clinical exposure. At present, many dental institutions in India follow a curriculum wherein 6 to 12 months of PG program is spent on preclinical exercises. This reduces the optimal available clinical exposure to the PG student in managing variety of clinical cases pertaining to this specialty. So the purpose of this study is to determine the optimal preclinical exercise duration in the first year MDS students by analyzing what is existing now in the most of the institutions and what is being proposed by the stakeholders who are involved in this curriculum. The context is the BDS students have basic preclinical and clinical exposure during graduation. Therefore, providing refresher exposure of preclinical exercise for limited time provide an early clinical entry to the first year MDS students to the clinics. So methodology, the stakeholder of my study are the MDS students who are in second and third year, postgraduate faculty, administrative staff of these postgraduate institutes. The sampling, it's a pilot educational project having a sample size of 70. The setting is a PG students, faculties, clinicians, administrators of PG dental institutions. The nature of this research is a quantitative, descriptive in the form of a questionnaire. A Google form having 15 validated questionnaires were administered among the PG students, faculty members, clinicians, administrators of this prosthodontic specialty, fulfilling all the inclusive and exclusive criteria. Demographic data were kept optional, were tabulated and subjected to statistical and the inclusion criteria and the exclusion criteria which have been included for formulating the questionnaires and subsequently circulating to the participants. These were the 15 questionnaires which have been validated and subsequently they've been administered to all the stakeholders as mentioned in the methodology. The results, this research aims to determine the optimal preclinical exercise duration in MDS students by analyzing what is already existing in most of the institutions. And these responses were gathered from the 70 participants who are willing to take part in the questionnaires. And all these responses were complete were considered as valid to apply statistics. The data was classified into 4 categories for the existing and the proposed preclinical exercise durations. In the existing duration responses, the responses were up to 10% who agreed to have the existing preclinical exercises of 0 to 3 months, which forms 7 participants. 3 to 6 months were around 64%. The existing thing is the maximum percentage, which includes 44 participants. 6 to 9 months for the 15% of the participants, which is around 11 participants, and 9 to 12 months were there in some institutions when being asked given by the 7 participants. The proposed duration responses stakeholders were 0 to 3 months, which is very high. 50% of the participants were for the 0 to 3 months for the duration of preclinicals. 3 to 6 months included in 1/4 of the participants, and then almost negligible in 9 to 12 months. When we've been represented in a graphical manner, the duration which was there as a 3 to 6 months in the most of the existing practice were being shifted to 0 to 3 months. A descriptive and inferential statistics were applied. Here we see this mean being shifted from 5.28 in the existing preclinical duration curriculum followed, and the proposed or willing by the most of the participant is 2.5 months, and the standard deviation is not much. And when to determine if the difference between the existing and the proposed distribution, the significance, we use the chi-square test, and wherein the null hypothesis is that there is no significant difference between the existing and the proposed clinical exercise duration, and we obtained a significant p-value less than 0.05%. A statistical analysis indicates a significant shift in the proposed duration of the preclinical exercise for MDS students compared to the current duration. The mean of the proposed duration is being 2.5 months compared to the existing 5.28 months, and the difference is supported with the p-value. The results suggest that study participants feel that shorter preclinical training durations would be more appropriate. The subsequent questionnaires are also being tabulated, including their which complements what we are looking as their results. So all those were taking close to what they are intending to utilize this duration during this period, and whether implementing these things would be of any benefits in comprehensively without compromising on the clinical acumen they are going to acquire subsequently. So these were all the additional graphical representations of the questionnaires, which would also give us an indications for our further understanding or further studies, as this being a pilot study, which could also give us an indication to carry our directions of our study in the future prospects. So we all know that preclinical exercises are essentially for building core skills and also gives us a foundation before a transition of a student from preclinicals to a clinical practice. Duration of these exercises varies among various institutions, and it's essential to know that what is optimal required and which can be implemented and can be used effectively. In our results, when we have seen the participants feel that 0 to 3 months is sufficient to acquire necessary skills before entering the clinical practice. A shorter clinical duration may also reflect desire for early clinical exposure, which is also supported by the earlier studies, which may not be similar to these studies. They are being comparable to these studies, that early exposure to the clinics, how they are effective or they are better for the acquiring the knowledge required for an MDA student. Certain limitations to quote here is the study has got a sample size of 70, which do not represent full diversity of MDS program across all the regions and institutions. Hence, a further study aiming for a larger group, including a diverse group, is required. And also it relies on the self-reported data which can also be investigated on ground is also being required. And which leads to a further recommendations. The recommendation of the future research is how this studies could investigate the impact of different preclinical duration on the students' outcome, including their preparedness for clinical practice and overall competencies. Additionally, a qualitative research involving interviews with both students and educators could provide us a deeper insights into the perceived benefits and limitations of various preclinical training durations. To conclude, there is a clear preference when we have seen these questionnaires and the response that first-year MDA students for shorter clinical duration with a majority favoring for a period of 0 to 3 months. However, any changes should be carefully evaluated to ensure essential competencies are not compromised or missed out. So what are the implications of this study is, there's an improved student satisfaction. When we have seen with the additional questionnaire, we have seen that the student satisfaction getting into early into the clinics has got improved student satisfaction, which aligning the preclinical exercises with the students' need for enhancing learning satisfaction and engagement. Amalgamating the preclinical exercises along with the early transition into the clinics would give a better student satisfaction. There is a requirement of curricular development and optimization to balance out between the amount of preclinical exercise which is required, which is maybe in certain part as a repetitions of what is being learned in the graduation. And it also gives to build a required foundation skill. The preclinical skills are required for developing a foundation skills and boosting confidence and performance when we are actually doing the clinical application. Hence, a fresher up preclinical exercise is essential in an optimal way, but not to prolong it for a longer period. And finally, this would also give us a specific resource allocation and institutional planning by giving how much the preclinical exercise environment to be created and with the clinical exposures to the students. I thank my faculty to understand our limitations and lacunae to guide through all through the year by step to completing and understanding the course, and colleagues for supporting and helping through our journey. These are my references. Thank you.
Make it more practical.
Too much of written matter in this.
Too much of written matter.
All right.
And don't add so many colors.
Colors.
Colors have to be 1 or 2 or maximum 1 light, dark and 1 more. You cannot have so many colors.
All right.
Yeah.
Arun, when you go for a questionnaire like this, first year MDA student is always eager to go to the clinics. So if you want to ask him whether he wants to shift from 3 to 6 months to 0 to 3 months, immediately they'll all say, yes, sir, 0 to 3 months. We don't want to extend it for 3 to 6 months. It's a natural response, you know. But then your whole project is based on that only. So I would have suggested, if you want to go ahead with the project again after your project is over, you should also ask for justification. Why does he want that 3 to 6 to come down to 0 to 3. The justification cannot come with a questionnaire. So there has to be probably in this design some open-ended questions. It becomes very dangerous when you ask open-ended questions because compilation of open-ended question is very difficult in a qualitative analysis. But then how do you justify? There is no justification without compromising the clinical expertise. You say that time and again. But when he says that this 3 to 6 months can be reduced to 0 to 3 months, there is nowhere in your questionnaire or in your statement or your discussion why they are saying that. What is the reason?
Sir, first of all, sir, this questionnaire do not include the first MDS. The people who have crossed first MDS,
Correct.
the second and third,
MDS. Yeah, correct. So
and,
second
and,
MDS
and,
student.
and the faculty who are there. And when we add, there is a questionnaire, one question stating that why they want it to be reduced and how they want to utilize it further down. The most of them wants to observe the clinical procedures and also to take up certain aspects of the MDS because there are certain procedures, certain lab procedures are being a repetition of what we have learned in the BDS curriculum.
So there are open-ended questions.
Yes, sir. So they've been asked how they want to utilize this thing and what justification they want to give it. They can give it in an answer form. There is no the multiple choice there. So they can give their own things. There we have come through that they want to take up their thesis topic, study on those thesis topic rather than spending an elongated time on their preclinicals.
Okay. You have two open-ended questions there.
Yes.
Okay. Thank you.
Arun, actually, every student is different. The milestone what he has reached in some colleges, you can ask people. They don't even know properly to mix the impression material like alginate or manipulate elastomeric. They require probably a showcasing in the demonstration or using it in the clinic only. So the program only should not be rigid 0 to 3 months, or I would say it should not be more than 15 days but we have worked and come. We had no preclinical time at all. We just went into the clinic. Same college. So that is one thing. But now I will not say that. I'll just say that at least a month. What you require more is to go to the departments like perio and endo. I mean, that can be incorporated by us, wherein they do the post and core and how to prepare and how the other things like endo is involved so closely with us and all those things. And apart from that, side by side, they can. But I am not aware how much the students are aware of everything. And we are not bothered about today those exterior techniques. Today, we are all bothered about, people are talking of implants and people are talking of digital impressions.
Yes, ma'am.
So we, I think, need to rewrite what we think in entire prosthodontics. So at least the questionnaire should be made robustly. Questionnaire can be improvised.
All right.
Yeah.
Thank you.
We can make it with the 7 people together. The questionnaire will come very good. 7 minds working.
They have helped, ma'am. They have these questionnaires have been made with the help of.
But now rethink about it. They can rethink about it.
Yes, ma'am.
Let's brainstorm once. Yeah. Okay. So I thank all of you. You all presented well. And sir, I really profusely thank you. Ask Gaurang to share his screen. And sir,
no, I should thank you. I should thank you because they were wonderful projects, all different.
But
all
I
the 7
awake,
of them
sir.
were diversified.
Kept you awake for such a long time.
Siddharth, can you switch on your video on?
Sir, 1 second, sir. 1 second.
So this is the certificate with your project name. Please see that the spelling is right.
Rohit,
This is
we
just
can clap for
the
everyone.
certificate is not made. So don't click and print it out. Okay. This is for Meenakshi.
You all can clap for everyone, at least.
Next. Anand Kumar.
Thank you, madam. Thank you, sir.
Meenakshi went away, so she didn't say thank you.
I'm here, ma'am. Thank you so much, ma'am. I'm here, ma'am.
Gopal Krishnan. assessment of postgraduate, right? No? Yeah. We will modify the certificate, but virtually I wanted to give you. Yeah. The next, Shilpa.
Thank you, ma'am. Thank you, everyone.
Next. Arun Kumar. Colonel Arun Kumar. Sorry.
Thank you, ma'am.
Yeah.
Lieutenant Colonel Arun Kumar.
Dr. Siddharth.
Thank you, madam.
Yeah.
Thank you, ma'am. I was muted that time. Thank you.
I thought you said. And Meenakshi didn't say. I didn't hear. You just said.
Congratulations, everyone, for successful.
Thank you, sir, for guiding us.
Thank you so much, sir. Chinmay sir, Gaurav sir.
Yeah, take one photograph.
You know, some people's photo is coming.
Yes, sorry, sir.
As if they're masked. सिद्धार्थ तेरा है ना ऐसा मास्क मैन जैसा आ रहा है. इवन मीनाक्षी का बहुत लाइट आ रहा है तो मास्क लगता है.
वो पीछे एक्चुअली वर्चुअल बैकग्राउंड है ना, इसलिए दोनों में.
Dr. Siddharth, can you just turn on your video?
Yes.
I don't know why Siddharth joins too.
Madam, in laptop webcam is not there. I have joined from phone, madam.
Have you taken?
Yes, taken.
Ma'am, one small request, ma'am. Just wanted to know my initial, ma'am. If in the certificate, can I just see once?
Siddharth, can you show her? You want to read your names?
Yes, yes, ma'am.
So, Chari sir, how is Diwali there? Sir has left.
Sir is here, ma'am.
Sir, you are muted.
There is no Diwali like India Diwali, nowhere in the world.
Sorry,
so come to Diwali next time. Come to
Shivaji,
India next time.
In Shivaji Park, the way they have lighted the entire periphery, amazing colors. Purple, maroon, green, some blue, different types of gold, different types of blue. And Kandil, I don't know how much
Here also there is a park called Hagley Park in Christchurch. There about 500 Indians were there yesterday. They were doing some dance and fatakas and all that.
Yeah.
That was there in every city now. So many Indians are there all over the world. So they come together during the Diwali day, and it's a good gathering.
Sir, Christchurch, on the top of the mountain you go, you see the entire view so beautifully. No?
Yeah, it's a lovely place.
Lovely place, but quiet place.
Hardly anybody. If I see somebody, I tell my wife, "Dikh gaya, dekho, aadmi dikh gaya."
Yeah.
Okay.
Christchurch.
Thank you very much. Let me take your leave. Thanks a lot.
Thank you, sir.
Yeah, God bless you all. Thank you. Thank you, madam, for inviting me.
Sir, it's a pleasure. Thank you very much. Yeah.
Thank you, everyone.
Madam, any date is finalized, madam, for the IPS?
I'll inquire again and let you know. I think they will have it immediately after that one graduation. I don't know. I'll just let you know. Yeah. I'll just call up Sesha and put it in the group. I'll put it in the group. And also, after January, we will have a session. And competency-based education, we took it ahead a little bit. We told you about milestones, about so many other things, and continuous assessment. Do you remember?
Yes, ma'am.
Yes,
ma'am.
We'll see. Okay.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
Can we have can we just check for that certificate, sir? For spelling.
Yeah, ma'am, I'll just share. Just a minute.
Oh, okay, sir. Okay, sir.
All of you check once.
Yes, sir. Yes, sir.
Dr. Siddharth. Let's start from the beginning. Dr. Rohit.
Yes, sir. Correct, sir. Everything is fine.
Dr. Meenakshi.
Sir, pardon me, sir.
Yes.
Sir, it is from August 2023 to July 2024.
Yeah. Thanks for identifying that. I'll make
Yes,
that.
yes.
Yes.
Correct.
She specifically said ask push-up.
Dr. Sandhya.
Yes, sir.
Dr. Shilpa.
Yes, sir.
Lieutenant Colonel Arun Kumar, sir.
Yes, sir.
Dr. Siddharth. Yeah, so that's it.
Yes. Ma'am, just to plan our travel, ma'am, will it be on 22nd or 23rd, ma'am?
I think man left.
No, ma'am is here. Ma'am, muted, ma'am.
Muted.
I will let you know immediately.
Okay, ma'am. Okay. Yes. Thank you so much, ma'am.
Thank you.
Thank you, sir.
Thank you,
Thank you, sir.
everyone.
Thank you, everyone.
Bye-bye.
Thank
Yeah,
you so
thank
much.
you, ma'am.
Thank you, everyone.
Thank you all. Bye.
Bye.
Thank you.
See you.
Bye.